and we've generally started at 5 after the hour just to give everybody time to join. So at 3:05, feel free to start.
Okay. Right? Can everyone hear me? Okay. Um, let's start. So, hello everyone. I'm Noura Basumbul, a PhD candidate at the University of Michigan. So, I'm going to talk about the medical applications of radiation. I hope you found this topic interesting, and feel free to ask any questions if you have. So, radiation is applied in medicine at different areas, and the main three areas of interest that's found in medicine is the first one is radiation imaging, and I think many of you has already seen some of those radiation constructed images. So those are basically anatomical or structural images in which radiation is used to get a specific representation of the organs to be used as an elementary step for diagnosis. The other area of interest is in radiation therapy. So you have already heard about different types of treatment that's used for curing cancer, and one of them is using radiation to deliver a suitable amount of our dose of radiation to the tumor, and with the aim of just killing the tumor and causing the minimum possible uh, effects to the normal tissues. And then the third area of interest is in nuclear medicine. So this is another method that's used for diagnosis. However, the constructed images for this part is basically for functional or physiological representation of the organs. So as you can see, for example, this is the first figure represents a kind of treatment plan for radiation therapy. The second one is just a regular image of radiation, and then the third one is a functional imaging. We're gonna go over specific details about each topic, and let's start with radiation imaging. Okay. All right. So radiation imaging physics is basically starts with generating X-ray. X-rays are generated usually using X-ray tube. So just like a sword or a beam of electrons hits a target or anode, basically the most common used material is tungsten, and then based on the Bremsstrahlung production, so X-rays are produced and it undergoes some sort of filtering, just to make sure that we are using the intended amount of radiation. So most of the times we intend to get rid of the lower energy photons so we can get better quality images. And the main imaging concept behind this is that each type of tissue will interact differently with radiation. So each type of tissue will have different interaction coefficient or attenuation coefficient, and by then getting information about those attenuation coefficients or attenuation differences, we can construct those images. So as you can see, for example, in the figure, uh, differences in the attenuation coefficient between the bone and tissues is more obvious at the lower energy of photons. So that's usually the most used region of energies for differentiating in between the different types of tissue. So usually the energies of the X-rays that's used in diagnostic imaging is in the region of 100 or less, in order to be able to get advantage of the photoelectric effect to differentiate in between the different tissues. So let's talk about the first modality, which is called the digital radiography. It's kind of the regularly used modality for just getting a 2D images. It's just a static image, a snapshot of a specific part of the body. It's basically used in the chest region, so where we can differentiate between the bone and tissues. So as you can see in the figure, it consists basically of the X-ray tube that hits the patient, and then you will have your imaging modality, which will basically start with anti-scatter grid to decrease the scattering effect, and then a digital detector to record those X-rays that are able of penetrating the patient. And then by the presence of specific electron signal and processing softwares, we are able to construct those digital images. So moving into the main types of detectors that are usually of use in those modalities. So there are two main types that are used usually in the planar structure. So as you can see from the previous figure, it's a kind of a plane that consists of a single smaller elements of detectors that are used to detect the radiation. So there is the direct digital detectors and the indirect digital detectors. The direct digital detectors that has like the concept of interacting like with as the X-ray interacts with the detector like material, it construct like electron hole pair. So those are the solid state detectors, and then you form that like line spread function of the interaction. Those has the advantage of having like better resolution. However, like the time response is a bit like longer in comparison with the indirect digital detectors. So mostly amorphous selenium is the most used like type of detector for this kind of for this kind of application. And then the other one is the indirect digital detectors. Those are scintillators. So as incoming X-ray interacts with the detector, it produces a scintillation light, and then it's converted to an electrical signal using the photo diodes. So most likely cesium iodide is the most used material, and the scintillators has the disadvantage of it has a poor resolution in comparison with the direct one. However, like a needle structure like of the detectors, as you can see like in the figure, so help us in decreasing the lateral light diffusion and get like a better resolution and improve the signal that's detected. And that's like the figure shows how like the shape of that panel imager will look like. So the other modality is the computed tomography, and this is like the most common used modality in radiation imaging. So what it does is it collects like different projections of the object from the different angles, and then it back project those collected signal to construct an image of the organ that you are interested in. So the higher the projections, the better the image becomes to reconstruct. And then, as you can see, like a CT machine would be kind of like a ring shape that has like the X-ray tube, and then the X-ray detectors that spins around like the patient, and then like the couch will move toward like the position to get different like images over like the whole body. For example, if you are interested in getting like a full body representation of the image. So this, as I mentioned before, it's the most common used modality. So based on the differences in the attenuation coefficient, you are able to construct like the radiation images. For example, to the brightener the image, that means the higher the density of it, and then the lower or the darker the image means it has less attenuation. So you can see like the lungs appear in dark, and then the bones are in almost like white color. So CT scans has the advantage of getting higher higher contrast resolution, and also it gets rid of the superposition effect that's like as a result of a 2D imaging. So since it constructs like the image from different angles, so you are able to differentiate the overlapping like organs if you are just like depending on one single like projection, as it happens in the regular like digital radiography. And also it has the advantage that it provides like density characteristics of the different like tissues. That's why it's of important use for usage even like in radiation therapy as well. So the third modality is a more dedicated one. It's just used for breast imaging. So it's the only proven kind of modality to be used in breast imaging because of the higher like the smaller differences in the attenuation coefficient in between the tissues that constitute the breast. So it's basically like similar in terms of the different like components that constitute it. It's X-ray tube, a collimator, then the addition is that it has a compression paddle so that you get more homogeneous like shape of the breast for imaging. And then finally you have like the grid and the digital detector to collect the signal. So why we usually need mammography? So as you can see in the image, so breast is one of the most heterogeneous organs in the body. So it has different types of tissues. And with that, it becomes really hard to differentiate, for example, between carcinoma and the fibrous tissue that constitute the breast as the region of the regular like type of imaging. So as like the most common like imaging modalities use an energy test in the range of 100. So you can see that the attenuation coefficient is almost like hard to differentiate in between the two different types of tissues. So that's why there is a need for getting like a modality that operates at a much lower energy to be able to a bit like differentiate in between like fibrous tissues and carcinoma. So that's why like the main system requirement would be a special X-ray tube that has a lower energy and also small focal spot to decrease the degradation of resolution. Another thing is that, of course, you will need high resolution system for image recording and processing, high contrast, and also low noise. As you can see, like in the image, one of the disadvantages also of mammography is that it constructs images in 2D. However, like there is also what's called the tomosynthesis, in which you construct the 3D images, so you can be able like to see, for example, the exact like volume of the cancer and differentiate it from the different tissues. So the other area of interest is in radiation therapy. So radiation therapy is one of the different like methods of treating cancer. It has the advantage of being a local type of treatment. So you can think of it like to be similar to a surgery where you applied like that source of treatment to only like that specific part of the body that you are interested in curing. So it depends on the idea of that radiation causes damage to the DNA, and that damage will hence lead to either like the cell inactivation or death. And it has also been shown that during the reproduction cycle of the cell, it becomes much more sensitive in its reproduction stage, and it with that advantage, like we with taking into consideration that cancerous tissues are more has higher like reproduction rate in comparison to the normal tissues, that means that those tissues will be much affected by the damage that's caused by radiation in comparison to the normal tissues. So there are two main types of radiation therapy. The first one is called brachytherapy. In brachytherapy, or what's sometimes known to be internal radiation therapy, the radioactive sources are inserted or implemented locally inside the tumor. So either like for permanent time or temporarily, and the shape of those radioactive sources could be as a seeds, as you can see in this figure, or as needles in this other figure. And then as those sources will start to decay, they will deposit their energy around the tumor or inside the tumor based on the prescribed dose. The most commonly used sources are cesium-137, iodine, and iridium. The iridium is known to be a high dose rate source, so it's most of the times used to be applied remotely. So as you can see, like this machine implements like the seeds of iridium inside like the body that you are interested in treating, and then after a specific like period of time, it gets retracted back to the machine. And for that's what's known to be a remote radiation therapy or brachyradiation therapy. And there is also like a manual insertion using those like kind of grid that's called the applicator to insert like those needles manually, and most of the times those are lower dose rates, so there is like less effect into the personnel who is applying those needles. Uh, some of the common types of cancer that are treated with brachytherapy are prostate, breast, eye cancer, and gynecological cancers. Those are one of the like this image shows the eye cancer like blacks that's used to place the seeds inside them, so to apply like the dose locally to the eye. The other type of radiation is called external beam radiation therapy. So in this type of treatment, a linear accelerator, which is like this machine that usually applied a beam of radiation that hits the patient from the different angles. So as this machine rotates, you can access the tumor from the different angles. So the type of radiation could be photons or electrons. Those are like the most common used types of radiation. And then also photons and heavy ions are became like of interest in currently. External beam is the most common used type of radiation therapy, and it's like used for treating various types of cancer. Okay. Okay, how the radiation therapy process goes. So it starts with two main steps. The first one is the treatment planning, and the other one is the treatment delivery. The treatment planning, you can think of it as the prescription of the treatment. So it's basically characterized by taking the important treatment planning decision in order to get like a successful treatment. So it starts by characterizing your treatment. For example, what method you're gonna use, the total number of fractions, the dose per fraction, the total dose that you intend to deliver to the tumor. Also, what your maximum like dose limits to the other like normal tissues will be. And the other thing also to consider is the characterization of the treatment delivery. For example, whether or not you will use like brachytherapy versus external beam radiation therapy, and what will be like the type of radiation, whether it's electrons, photons, and the shape of the beam, how many number of beams you're gonna use, and all of that things you have to take decision about. And that would be, of course, like based on the tumor, its size, the type of the cancer, and all of that should be taken into consideration and then be assessed before you deliver the treatment to the patient, which is the next step. So basically, the process will start by patient simulation or imaging. You're going to take images of the patient at the treatment planning position, which will later on has to be like reproduced. So you do your treatment at the same position that you will deliver your treatment at. So you will have like to take images to make sure that you are positioning the patient at exactly the same position. And then you do like the treatment planning, which is contouring, basically working with those like images that you obtain in determining, for example, the volume of your tumor, the other organs of risk, and all of that things that should be considered as well. And then you do your planning. For example, as you can see in this figure, this plan, for example, consists of two beams, the first beam and the other beam, and you use some sort of beam shaping, and all of that based on the total dose that you are intended to deliver to the patient. Finally, after you make sure that you are getting the same dose that you hope to give to the tumor, you will go just like head and then place the patient at the treatment delivery position and deliver the dose to the patient. So external beam treatment has undergone like some sort of development throughout the years. So it starts basically by using like low energy X-rays, and then with the invention like of cobalt 60 machines. So cobalt 60 was used before like the invention of linear accelerators, which has then later on been implemented for doing like more dedicated treatment delivery. So we went from like a simple 2D treatment planning into 3D treatment planning, into more even more like complicated treatment delivery techniques, different like shaping of the beam, and then currently even like electrons and protons, which has the advantage of the Bragg peak effect, are used as well to just like deliver the dose to the shape of the tumor while delivering the less possible dose to the surrounding normal tissue. So you can see like with the improvement, we became even more and more robust in delivering the dose to exactly like the shape of the tumor, while trying to minimize like the effect to the normal tissues, as you can see like from the improvement throughout the years. And the work is still going on to meet that goal, which is delivering the same amount of the dose to the tumor while causing the minimum possible effect to the normal tissues. So finally, I'm going to talk about the role of radiation imaging in radiation therapy. So why we need radiation imaging. So it's not only for diagnosis, for example, to tell, for example, if there is like a cancer present or not. It's also used for the different stages of the treatment as well, starting with providing a full 3D representation of the tumor, for example, as you can see from the figure with the radiation images of a CT, we were able, for example, to locate that this is my tumor, and this is, for example, the lung, which would be like my organs at risk. So it's the first step to start the treatment planning with. And then the next step is also to provide the accurate geometrical representation. So we were able, with the aid of imaging, to determine like where the position of the patient would be, and also whether or not that position would be reproducible, and we try to make it the exact same to the treatment planning position as possible. And then also it also helps to provide like density information. For example, as I mentioned before, that CT scans has the advantage of differentiating the differences in densities in between the different tissues, and that is used for heterogeneity corrections for calculating the dose in more accurately and correct for any sort of heterogeneities as well. So the other rule that's important in radiation therapy is the usage of dosimeters. So there are different types of detectors that are of important use in radiation therapy. One of them is the gas ionization detectors. Most commonly ionization chambers. They are used in doing like full beam characterization and commissioning of the LINAC, for monitoring like the output of your machine, whether or not it's operated as expected or not. So it's kind of absolute dosimetry measurement that's performed with ionization chamber. And as you can see like in the figure, this is how like the shape of ionization chamber look like. I mean, like for those ionization chambers that are used in clinic. And then there are also a variety of solid state detectors, for example, TLDs, OSLDs, and many other detectors that are used either for patient specific QA, that's to make sure that once you do all of your treatment plan, you deliver, for example, your treatment first into a phantom to make sure that you are getting exactly like the dose that you are measuring. Especially for more complicated like treatment plans, you have to do a verification of the treatment before you deliver it to the patient, just like to make sure that the machine is operating as expected and you are not causing any damage to the patient, and like everything is operating as expected. For those like kind of, for example, 3D dosimetry gel, polymer gels are usually used. So you can see like how a gel will look like. So as they are exposed to radiation, they change in color, and then with doing like optical scanning, you can analyze the dose and so on. So the role of detectors is really important in radiation therapy throughout the different stages. And then there are different characteristics of each detector that make it like an important to consider whenever you try to choose a specific like detector for a specific application. Things you have to consider is like the sensitivity of the detector, Sorry for that. So I think now you can hear me. So we're gonna continue from where we left. I'm really sorry for that inconvenience. So we're going to continue from the dosimetry characteristics. So there are different types of things that you need to take into considerations once you choose your dosimeter. So starting with choosing like looking for um, the accuracy, the dose rate dependence, the energy dependence of your response, and also the convenience. For example, if you are looking into monitoring the dose during, for example, your treatment delivery, you wanted the reading to be a direct reading. So, for example, for that case, films or gels will not be used as they need like post processing. So, ionization chamber would be more convenient for that application, and so on. So, based on your application, the characteristics of the dosimeter, you're going to choose like the more suitable one for that specific application. So the third part of applicability is in nuclear medicine. In nuclear medicine, it's also a used modality for diagnosis, but a kind of different in terms of the concept. For in a regular radiation imaging, you actually visualizing the anatomical or the structure of the part of the body that you are interested in imaging. However, like in nuclear medicine, what you are looking to is the biodistribution of the radio nuclide tracer in real time and in space in order to allocate and visualize any differences in physiological or pathophysiological changes in, for example, a specific organ. So a simple like representation to give you an idea what we mean like by structural imaging and functional imaging. So as you can see, for example, in structural imaging, you see the brain as that specific volume inside like your head. However, like in functional imaging, you see each region of the brain as, for example, this region is the region that's responsible of thinking or speaking or whatever. So it's based on the functionality of each part of the body, not about its like structure or composition. So the scanning process in nuclear medicine would be kind of different in terms of the first thing is the amount of or the material that's sorry the material that's used for scanning. So in this case, you are not using an external beam of radiation, rather you are injecting radiopharmaceuticals or drugs inside the body of the patient, so it circulates throughout the bloodstream to reach the tissue you are interested in imaging. And then after a specific like period of time, after like the isotope intake or uptake, the patient would be placed in the scanner to construct images based on the decay of that radioisotope that is inserted in the body, and then you will reconstruct like images based on the reconstruction, for example, software to measure like those radiation and relate it, for example, to this specific like thing that you are willing to trace. So, what we mean by radiopharmaceuticals? So, radiopharmaceuticals are drugs that consist of two main components. The first one is the radionuclide, which is the radioactive material uh, that's usually traced throughout the imaging process. And the other component is the pharmaceutical. The pharmaceutical is the specified substances that has the ability to interact based on the mode of action or the pharmacological activity that either it participates on, which is it has a preferential for a specific like location inside the organ, or it participates in a specific physiological function of a specific organ. And that's why we choose that specific pharmaceutical material. So the types of the detectors that are usually used in nuclear medicine are inorganic scintillators. So as those has higher efficiency to detect gamma photons. So in nuclear medicine, what we are usually looking for is gamma photons, and basically the sodium iodine is the most common type of detector that's usually used specifically for gamma cameras. And then with the increase of the energy of annihilation photons, that's like the 511 photons, you will need much higher density kind of crystals. So that's why bismuth germanate detectors are usually used in PET scan. So there are two main types of nuclear imaging. So the first one is the single photon emission computed tomography. That's like the SPECT scan. So the main idea of it is that the radioisotope will annihilate and then decay to produce a gamma photon that will then be detected by a detector. Usually the detectors has a planar like shape, as you can see in the figure. So the detectors would be at those two different like region, and then it will start to rotate throughout like the body of the patient to capture like the decay of the radioisotope inside the region that you are interested in imaging. The most common used radioisotope is actually technetium-99 and also iodine for some type of thyroid specific like application. Okay. There are different types of radiopharmaceuticals that are used in medicine based on the different like clinical preferences. So for example, it's just like to give an example. So once you tag your technetium for that specific pharmaceutical material, it can be used, for example, for thyroid gland imaging. And if you tag it with the MDB pharmaceutical, it would be used for bone imaging. So it's the same radioisotope, but the pharmaceutical materials has a preference to be to be uptaken by specific organs. So that's why, based on the specific organ that you are intended to imaging, you are gonna choose your pharmaceutical material and also like the isotope. So this figure shows like the brain image based on technetium-99, and as you can see, like the uptake in this figure is a bit lower than the other one, and that gives like an indication of that there is a less intake by the brain at that specific region. So by looking into that small uptake, that means that the blood flow into that part of the brain is a bit lower than normal, and that will help you um, to diagnosis that there is a surgeon misfunctioning of that area of the brain. This is just like to give you an idea about the concept and how we use it and why. The other modality is called the positron emission tomography or the PET scanning. So you have unstable nucleus that will decay and emit a positron. At the end of its track, a positron will annihilate and produce two coincidence gamma photons that will then be detected by a detectors in coincidence. And that's like the main physics of positron emission tomography. So as you can see, like how this is like how a PET scan will look like. It's kind of similar to a CT scan. However, like the distribution of the detectors would be throughout like the whole ring in order to be able to detect those coincidence events at the same time. The most common used radio pharmaceutical in PET scanning is the FDG, which is the fluorodeoxyglycose. So why we usually use glycose? So usually a regular glycose is tagged with F18 radioisotope, as the glycose is one of the most important material that's usually used in testing like the metabolic activity of a cell. So the uptake rate is of that like specific material, which is the FDG, would be directly proportional to the metabolic activity of the cell that takes that FDG material. So there are specific organs that has been known to have higher uptake, for example, the brain, the kidney. However, cancerous tissues has the advantage of having a higher reproducibility rate and thus higher metabolic activity, and that will increase like the intake for any specific like region that is cancerous like tissues. So that's why like a PET scan is increasingly used for not only just like for diagnosing. For example, there are some sorts of cancer volumes that are not well differentiated with the regular type of imaging. So they sometimes use like nuclear imaging for well specified specifying the region that has higher uptake and hence higher uptake for the FDG material, and hence implementing like the existence of a cancer or not. And it's also used for staging and following up of the patient. For example, after you deliver for a different type of treatment, it shouldn't have like to be radiation therapy. For example, even like with specific like with surgery or so on, you detect like whether or not there is a shrinkage to the size of the tumor or so. So it has an important role in the different like stages of diagnosis, staging, and follow-up. So I'm just like wanna give you like an indication of the disadvantage of nuclear medicine. So you can see like a PET scan doesn't have like exact like characteristics of the different anatomical structure of the part that you are imaging. I just give you, for example, this dark point which indicate there is a higher uptake of the radioactive material at that specific region, but you don't know where exactly that region is. And in contrast, so a CT scan will give you, for example, an image of the full like region. However, you cannot tell where is exactly like whether or not there is a cancerous volume inside the heart, for example, in this case or not. So there is always like a need of fusing like both different modalities. So a combined modality called PET-CT, where you use like a CT scan that's embedded into a PET scan, so that you can co-register like both images at the same image and at the same patient setup to well define whether or not you have a cancerous tissue and where exactly that cancerous like volume occurs and what's like the exact position of it and the volume and everything. So dual modalities has even like increased usage currently. With that, I would conclude like my talk for today. And I'm also listing like some sort of references if you want to like to get more information about any specific topic, and feel free like to ask questions or email me with your questions, and I'll try my best to answer them as well as I can. And again, I'm sorry like for that technical issues. I'm gonna check the chat to see if there is any questions. Yeah, thank you all for attending, and I'm glad that you liked the lecture. Um, I'm seeing a question about what are the sources of low dose rate. So the lower dose rates are basically based on the activity that you are inserting into the tumor. So there are different like important factors to be considered for brachytherapy, which is like the energy of the photons or the type of radiation that's emitted. The decay time also plays an important role, and then like the activity that you insert your sources at. So some of the different sources can be used both as a low dose or high dose dose rate like type of treatment. But for example, like iridium is one of the known to be like high dose rate like sort of sources. And then also, for example, the iodine is one of the low dose rates, and it's also there are different types of isotopes as well that are used, and some of them to be like considered over the other based on that. Okay, so I think that's it. I cannot see any further questions. So yeah, if you have any further questions, you can just like email me. Thank you all for attending and have a good rest of the day.